Dr. Debra Kissen. I am founder and CEO of Light on Anxiety Treatment Centers, and I wanted to spend a few moments with you sharing some information about what is CBT. So a common question that we get is, what is CBT? How is it different than talk therapy? And so I wanted to share just a bit of background on this important question. So starting with the term CBT, what that stands for, the C is cognition. So those are the thoughts that we have. And then the B is for behavior. So those are the actions that we take in our lives. And then of course the therapy CBT is how we work with thoughts and behaviors to create effective change. So the first step of CBT therapy is that we're identifying with clients, always actively participating and leading their journey. What are some of the maladaptive cognitions, thoughts that may be getting in their way? So depending on what their treatment goals are, how are certain thoughts showing up that are blocking life satisfaction? And that might be a thought of, I'm a loser, nobody likes me, so I'm going to not go to a party. It might be a thought of, I'm going to sound silly if I ask a question in class, and then maybe not getting the grades that a student would want. And then the behaviors, some sample behaviors may be, I'm going to not drive on a highway for the fear that I feel out of control. It's not safe for me to drive. So what are the behaviors that we're engaging in to try to manage our anxiety? And they might make us feel a little better in the short term, but they're actually getting in the way of living life on our terms. So once we've kind of identified the treatment plan, always based on the client's goal, it's not what I think someone should work on, but what is most important to a client, then we identify those thoughts, we identify those behaviors, and then we actively start working on replacing them, coming up with more effective coping strategies. So it's okay to feel fear, it's okay to feel anxious, but how do we manage those feelings and still live a full life? So what makes CBT special and different than talk therapy is that it is empirically supported. And so we're following treatment protocols based on what science tells us is the most effective way to move through and past emotional distress. It is also very action oriented. So yes, there's sometimes it makes sense to go backwards, to explore, to determine what are some of those maladaptive thoughts and behaviors. And then a very big component of therapy is, so what do we do now? What steps can I take today? What steps can I assign myself for the week to create meaningful change? So it's what happens in therapy, but then how it manifests in each client's life that actually is the secret sauce for seeing really post-treatment results.